everyone, welcome back to our channel Medical Coders Coaching World. Here is your tutor Bhuma Devi Chandrasekharan from Abu Dhabi. We are going to see about endocrine, nutritional and metabolic diseases, chapter 4 in ICD 10 cm. This code ranges from E00 to E89. In this chapter we are seeing diabetes mellitus. In short form I wrote as DM. Diabetes mellitus code is always a combination code because it consists of type of DM, type of diabetes mellitus and the body system affected by the diabetes mellitus. If there is any complications for the affected body system, then that code also included in the combination code. We have to select the combination code for the all the chapters, okay, not only for this chapter, for all the chapters. If the disease is having the combination code, then we have to directly go for the combination codes only. And in this chapter mostly the combination codes are there. So the DM, diabetes mellitus, is of two types. First is type 1 or juvenile DM, which is common in the childhood. From the childhood the patient is suffering from the diabetes mellitus. And type 2, that is after the childhood age, after attending the puberty, in between if there is any diabetes comes, then it will be the type 2 diabetes. The code is for type 2 diabetes is E11 and the code is for type 1 diabetes is E12. If the doctor is not mentioned if the doctor or provider is not mentioned the type of the diabetes, then it will be the type 2 diabetes. Because the doctor, if it is a type 1 diabetes, then the provider will mention it is a type 1 diabetes because the patient is suffering from their childhood. So if the doctor is not, if the provider not a doctor, if the provider is not mentioning the type, then it will be by default it will be the type 2 diabetes and the code is E11. Then DM and the use of insulin and oral hypoglycemics. Oral hypoglycemics is nothing but the diabetic medicines, okay. Insulin is always, we know the insulin, the sugar patient, diabetes patients are using the insulin, okay. The provider is not mentioned the type of DM. The type of DM is not mentioned in the documentation, but it is mentioned as the patient using the insulin. Like that, if they are mentioning, then we have to go for E11 codes and we have to give the add-on codes in Z79 category codes we have to give. Okay, this is the one point. The second point is, if the patient is using the oral medication and insulin, they are taking for the long term. Oral medication and insulin means they are taking for the long term, which means the diabetes drug and insulin is taking by the patient. Then we have to give the codes. Long term current use of insulin code we have to give. We should not assign the code of Z79.4 codes, which means Z79.4 code is for doctors is giving the insulin to the patient to control the diabetes temporarily. So that code we should not use. The patient is using for the long term. The oral medication and the insulin is used by the patient for long term. So we have to give the long term current. At present also the patient is using the medicines, okay. Current use of insulin codes we have to. This is one of the question I got in my exam. So be clear of it. If the patient is using for the long term, then we have to give the long term codes only. We should not give the temporary codes. And the next is complication due to insulin pump malfunction, which means the insulin pump is not working properly. If the pump is not working properly, then it will be underdose or overdose. If it be underdose of insulin, then we have to give the principal diagnosis of T85.6, which means under the insulin pump is not working properly, like that device is not working properly, that code. And the secondary diagnosis is T38.3x6, undergoing of insulin and anti-diabetic drugs, oral hypoglycemic anti-diabetic drugs. We have to give this code as a secondary diagnosis. And the overdose of insulin code. Overdose of insulin means if we are giving the medicines as a overdose, then it will become a poison of our body, right? So overdose of insulin code, the principal diagnosis will be the mechanical pump failure is the principal diagnosis, T85.6 is the principal diagnosis, and the secondary diagnosis is T38.3x1, which means poisoning of insulin is the secondary diagnosis. These are the complications of the which is caused by the insulin pump failure and the secondary diabetes mellitus. We are now going to see about secondary diabetes mellitus. The secondary diabetes mellitus is nothing but the diabetes which is caused by any other disease. The diabetes is caused by any disease of our body means then it will be the secondary diabetes mellitus. There is a 3 category in this. E08, which means diabetes mellitus by any underlying disease. Any disease is causing the diabetes, and E09 is for drugs and chemical induced diabetes. E13 is for other specified diabetes. Now the secondary diabetes mellitus due to the pancreatectomy. Okay, ectomy means the removal of some organs. Okay, the removal of the organ. So pancreatectomy means pancreas is removed. So the diabetes is caused by the removal of pancreas. Here the principal diagnosis is E89.1. This is for post-procedural hypoinsulinemia, and the secondary diagnosis is E13, other specified diabetes mellitus, and the add-on codes is G90.41, which means acquired absence of pancreas. That means there is no pancreas in our body, the pancreas is removed. That code is the add-on code. So these are the coding guidelines for chapter 4 in ICD 10 CM. If you are having any doubts, please personally message me in Instagram or email. For support, keep watching our channel. Don't forget to like, comment and share. Subscribe our channel and press the bell icon for our updates.